people concerned as you are about what happens in your community, and we hope to be able to work with you to help solve many of those problems. So what I would like to do first, very briefly, is just tell you a little bit about North Shore LIJ, or the healthcare system, because I don't think many people know a lot about it. And I will do this very, very briefly. And my comments overall will be relatively brief. I will turn it to Maurice LeBon, then, who will go through the actual facility that we are proposing in some detail, which will give the opportunity for questions, which I think is probably the more relevant part of the presentation, is to be able to put questions from the board members as well as from you, the public, and we'll be delighted to answer them as fully as we possibly can. But just a little bit about North Shore LIJ, because many people may not know us. We are a very, very, very large healthcare system, and it began out in Long Island. So we currently are in Nassau, Suffolk, Queens, Staten Island, and we, a year ago, moved into Manhattan with the acquisition of Lenox. We actually have 15 hospitals in total. We have over 200 outpatient ambulatory sites. We have home care. We actually run 12 emergency departments, comprehensive emergency departments, the equivalent of what it is we'll be talking about here tonight. We are a major academic center. We're one of the largest teaching academic centers in the country. We have about 9,000 physicians and that are credentialed and are part of our healthcare system. That includes also 2,000 full-time salaried physicians. We have a children's hospital. We have a psychiatric hospital. We are one of the largest providers of mental health and psychiatric services in the state of New York. We have 5 tertiary campuses, which means the high-end hospitals that do open heart surgery and things like this, and the rest of community hospitals. So we've got the full continuum of care. We also are big into research. We have a very, very large research enterprise. And on the educational front, just so you know, we are just about to open a new medical school, which will actually open 4 weeks from today. This is a medical school in partnership with Hofstra University, and it's the only new medical school opening in New York since 1963. So the point I want to make here is that we're a very, very large player, the largest in New York. And we're very, very, very focused on working with local communities. And one of the things I think that distinguishes us from a lot of others is that we work very, very closely with local communities all over the region where we're located. We treat everybody, because I know this has come up in a number of times in some of the material I've heard. We turn away nobody. We treat everybody. We, in fact, have the most liberal financial assistance policy in the state of New York, so that for people that have problems, that don't have insurance, or have problems getting care, we have a very, very liberal policy to make sure that nobody under any circumstance is turned away and is not treated. We've taken hospitals over the years and other facilities that have been in dire difficulty, and we've turned them all around. We've actually never walked away from anything. Once we get involved with something, we stick with it until it works very, very, very well. We only believe in doing things the right way. We just don't pop into a place, do something, and then it doesn't work, and walk away. We don't do that. We have actually never done that in our history. We're unique in that situation. Now, how do we get to this point? Well, we got involved in Manhattan. Now, people think that we've not been in New York before. But remember, we've been in Queens and Staten Island. So we're a huge player in New York, but we were not in Manhattan. We got involved in Manhattan over a year ago. And we now have, as you know, Lenox Hill Hospital, and we have the Manhattan 90 Hospital on 64th Street. And we got involved here in responding to a request from the state that we put a proposal out to open up a facility in this area. And we then started to work with the Rudin family. And as you know, I watched and I was familiar with St. Vincent's for a long time. Very familiar with the hospital. I watched what happened to the hospital. I understood, you know, the difficulty that the hospital was having. We were very involved, by the way, when the hospital closed to make sure that we were able to accommodate a number of the doctors that were left not having a place to treat their patients, and we dealt with many of those circumstances back last summer. And so what we're proposing here, by the way, is to bring back to the area a major healthcare facility that will provide basic healthcare to the community in an excellent location, high-end. It is not a hospital, let me just be clear. What we're proposing is not a hospital, but it can provide basic healthcare for almost all situations, because what we're talking about here is an emergency department, which is part of a larger facility which will have ambulatory surgery, have a major imaging center, have physicians' offices, and we do have space that we haven't programmed for other services that we can do there as a result of the continuation of the needs assessment. But the emergency department that we're talking here is exactly the same as the emergency department in most hospitals. In most hospitals, I know people are wondering how could that be, but that is the situation. But it does not have our beds on top, right? About 90% of people who come to an emergency department get treated and released. Small handful of people, small percentage of people come to an emergency room, like a typical emergency room in most hospitals. For example, I know that there was a situation that has been raised about trauma. Most hospital emergency departments in New York City do not take trauma patients. St. Vincent's did, but most hospitals don't. These are very few and far between in terms of need. You can actually stabilize a patient and then transfer them. I'll give you a particular personal example. And you may have heard about this because this has come up in other situations. I suffer from heart disease. I have a major cardiac problem. It's genetic, it's in my family. I was at home and got major chest pains. Was taken to our local hospital, which is one of our hospitals. They were able to treat me there, stabilize me there, and I needed a surgical intervention, which could not be done at that hospital, and I was transferred. And the surgical intervention was done at another hospital. This is very standard in most hospitals around the region. And Isama is here, who is the head of all of our emergency departments, and he can talk a little bit more about this. So I will let Maurice go on in a minute go